Tip 1. Get your equipment ahead of surgery. Your surgeon's office will provide prescriptions for any equipment you will need, like a brace or walker. If you have not received any equipment prescriptions for your doctor, ask about them. It's a much easier transition to home if you already have the necessary equipment available. If for some reason you didn't get your equipment prescriptions ahead of time, our case managers will make sure you have them at discharge. Tip 2. What to pack. We recommend 1 or 2 sets of comfy clothes like pajama sets, sweats, shorts, or loose shirts. Your clothes should be loose enough that if the surgeon places a drain in your back or neck, that your clothes can go around it. Usually if you have a drain placed, it will come out within the first 24 to 48 hours after surgery, and it is there to help prevent a hematoma at your incision site. You also want to pack a pair of non-skid shoes that have really good traction. Patients have had success with Croc-style shoes that you can just slip your feet into. Whatever shoes you bring, make sure that they have sticky soles for good traction. The last thing we want you to do is fall. The hospital will provide gripping slipper socks if you prefer. Tip 3. Contacting your nurse during your stay. The whiteboard in your room will list your nurse's name and often a 4-digit extension, which will get you directly to your nurse's cell phone. Instead of using your call light, you can use the telephone in your room to call your nurse directly. Tip 4. Ordering meals during your stay. Based on your doctor's orders, our dietary staff will deliver a room service menu for breakfast, lunch, and dinner. During the meal periods that are listed on the menu, you can order your meal at the time that is best for you. Just use the phone in your room to call the 4-digit extension on the menu and the dietary team member will take your order. Your meal will be delivered in your room between 30 and 60 minutes after you placed your order. Tip 5. Getting your medications for home. The hospital does not have an outpatient pharmacy, and we are not able to send you home with any pain medications. You may want to have the person picking you up on your discharge day to first come to the hospital and get your prescriptions, which should already be in your chart from your nurse. They can then drop these off at the local pharmacy to be filled while they return to the hospital to go over the discharge paperwork with you and your nurse. Then on your way home, the prescriptions can be easily picked up without having to wait on them. Tip 6. Decreased appetite after surgery. After surgery, it's normal to experience a decreased appetite, but it's important to nourish your body regularly to promote healing. Once you're home, try eating 6 small meals per day instead of 3 large meals each day. Tip 7. Keep a log book. At home, it is helpful to keep a log in a notebook to track your pain medications, including the name and when you took it, your bowel movements, how much you're eating, and when. By keeping a log, you'll easily track when it's time for your next dosage of pain medication and when you need to request a refill. Remember, you must call your surgeon's office at least 48 hours in advance to request a refill. Tip 8. Medication refills. Your pain medications are narcotics. By law, they can only be filled with a paper prescription and automatic refills are not allowed. You must call your surgeon's office at least 48 hours before you run out of your pain medications. You'll leave a message on their refill line and someone from their office will call you back within 36 to 48 hours. If your pain medications will run out over the weekend, be sure that you call no later than Wednesday night or Thursday morning to request a refill. Once the prescription is ready, someone will have to pick it up and take it to your pharmacy. It's against the law for narcotic prescriptions to be faxed or mailed.